Okay, well, welcome. And it's my pleasure to be here this evening to hopefully participate in what will be not only a presentation, but a discussion and a collaboration around a topic that's really important to me. And that's really around how we expand our conception of what it means to heal. And specifically, the title of tonight's talk is Moving from Managing Disease to Healing, using a multidimensional approach. And if you have no idea what a multidimensional approach is, that's fine, because that's part of what we're going to be talking about tonight. And we're going to talk about it in the context of a very specific health condition, which is uterine fibroids. So my name's Nicole Winbush, and I am a physician. I'm a board-certified family physician, and I am starting a practice in Durham, North Carolina called Sankofa Healing Arts and Functional Medicine. And in addition to being board-certified in family medicine, I have certifications in integrative and holistic medicine and functional medicine, as well as training in medical acupuncture and energy psychology and craniosacral therapy. And the practice at Sankofa Healing Arts and Functional Medicine is really about finding ways to integrate all of these approaches and modalities for reasons that you'll learn about this evening, because they're really foundational to what I feel is offering a comprehensive approach to support people in their healing journeys. And so if you don't have a lot of knowledge or information about what is energy psychology or craniosacral therapy, I'm not going to really talk about that right now. We may have some time at the end, and I'm happy to answer questions, but I also have my website listed there. But in my practice, as well as just this path that I'm on, I really see my role as being a bridge and a translator between the worlds of Western medicine and biomedicine, and really what I feel is being called for in this time, and that many people are seeking both individually and collectively as we move through these changing times, which is a more expansive approach to our health and well-being, and a more expansive approach to how we think about our healing. So in the next few slides, what I'm going to show you, mostly in pictures and some editorialization, is my journey and the trajectory of my career over the past 20-something years in medicine, and what I have observed that's really led me to believe that we need to have this more expansive multidimensional approach that we're going to talk about. So I started attending medical school probably close to 25 or 26 years ago, actually more than that, 27 years ago. And through the course of my medical training, through my training as a family medicine physician, I became very skilled and adept at managing people's chronic health conditions. And what that really looked like a lot of times was medication management, starting medications, adjusting medications. And that, I want to be clear, has an important role to play. We have many people who are living with chronic health conditions, and they need to have effective and compassionate care. But what I found was more and more that I was seeing people who were frustrated with this model, frustrated with the limited amount of time that we had to really talk about ways that they could be supporting their health that did not involve medication, ways that they might be able to lessen their chances of developing other chronic health conditions. And so that frustration that I was feeling, both in the limitations of my own practice and the frustration that I was hearing expressed from the people that I was working with, along with starting to develop some of my own chronic health conditions, led me on a journey where I started to work more seriously with integrative and holistic approaches, as well as functional medicine. First, as a way of addressing the chronic health conditions that I was having so that I could avoid the use of chronic medications. And then when I had good effect using integrative and holistic approaches, going on to learn more about them so that I could share those approaches with the patients and the people that I was working with. And what you see represented here in this figure is really the idea that undergirds functional medicine, which is an approach to doing integrative medicine, which is to try to track back and find the root cause of various chronic health conditions. And it's not always as neat as it is laid out in this picture here, that there's just one root cause. And I think a lot of us have heard about inflammation as being a cause for many health conditions, and inflammation in and of itself has many things that can drive it. But this is where I went on my journey, where I started to more seriously study and pursue integrative and holistic approaches, and to use those with the patients that I was working with. And I did that for several years, and it was really gratifying to find ways to be able to support people in doing some of those things that they had expressed to me that they wanted to be able to do, to find ways using lifestyle and approaches to better manage their chronic health conditions and prevent them. But over time, I also started to have some concerns. And I think this image got cut off. It's actually a question mark on top of this figure's head. But I was starting to have some questions. And there were some ways that I saw integrative and functional medicine reproducing some of the same issues that I'd seen in my traditional Western medicine clinic. One of the things that I saw is that just health issues in general were becoming more resistant. And what I mean by that is things that had worked in the past, even when working with people from an integrative and holistic standpoint, were becoming no longer effective, or maybe only produced temporary shifts. And I started to wonder why that was. And there can be a lot of reasons for that, and we might talk about that in the Q&A, but that was one of the observations I made. I also made the observation that there were ways that I also saw that this integrative and functional medicine approach were starting to, again, reproduce some of the, how do I want to say it, some of the ways in which Western medicine operated. So for instance, a pretty large reliance on nutritional supplements, almost akin to the way that people were engaged in polypharmacy and being, prescribed lots of different medications. I would start to see people coming to me on longer and longer lists of supplements that they really weren't clear why they were taking. And there is also this phenomena that I noticed of what I like to call gatekeeping, which means that kind of the access to what's behind the curtain was being limited. I think it's really important that, yes, there are skills and tools that require physicians and healthcare practitioners to be trained to use, but I think it's also really important in terms of education and empowerment that as much as we can, we offer the people that we're working with tools for them to be able to self-manage and self-direct their care. And I wasn't always seeing that happen. And finally, I just had concerns about how we could better integrate these two worlds of folks who maybe had chronic health conditions and were being managed with medications, but also wanted to have a conceptualization and understanding of how they might use some of these integrative and functional approaches and use them all together. So that is the ground on which I started to think and was operating. And what this slide is just showing is that all of this was also in the background of an incredible amount of volatility and uncertainty and change that's continuing to happen in our society. And you can kind of look at that on any level, whether it be political or the environment, just the social environment, economic. And so I think that also influences why, for instance, we're seeing more entrenched health conditions. There's deep and profound levels of stress that people are dealing with, and environmental degradation and exposure to toxins and levels of intergenerational stress. So all of that contributes, and I think pushes us and calls upon us to find a more expansive approach to thinking about our health. And so that's what we're going to talk about. And I'm going to briefly touch on, I think I'm going to go even a little bit more quickly through this, the current state of our healthcare system. But moving from there, we're going to start to talk about what are the assumptions that underlie this what are the thinking and the assumptions that underlie this current healthcare system that we're living in, and what really is the new paradigm that we're being pushed towards and that I think people are really seeking, and how that's all formulated within this dimensions of health model that I'm going to share with you tonight, that we're then going to apply to thinking about fibroids. So these are the couple of slides that I'm going to go pretty quickly through, because I think most of us know this, that we've got a lot of challenges in our healthcare system. It's expensive. People don't have equal access to it. And it really focuses on disease rather than prevention, as I just spoke about. And the outcomes of that system are decreased health outcomes. And we're seeing actually decreases in the life expectancy, where we have the average life expectancy in the US is at a 20-year low. But the theme that I want to talk about is the last one in red, which is the opting out. That because of the high cost of this system, because it's not really addressing people's needs in terms of being expansive and responsive and individualized to their health concerns, people are opting out. You both see that on the side of people who are seeking care, people choosing to go elsewhere, outside of insurance-based models, outside of traditional care arenas to get the care that they're looking for. We also see practitioners opting out and just leaving the profession of healthcare, and also trying to find ways to be more responsive to what it is that they came into the profession for, as well as to be more responsive to what they're hearing that the folks they work with want to have in terms of what's available to them. So with that, I'm going to pause, and I know we're a small group, but if people have anything that they want to share, I know we are recording, and if for some reason you don't want to say it out loud, if you want to put something in the chat in terms of any experiences that you've had, or if you really feel like the current healthcare system meets your needs pretty well, or if it's not, the ways in which it isn't.
I guess I would say that I've had a lot of varied experiences with the healthcare system. I believe that it is broken, but not feeling heard by my practitioner has been, I've experienced that on several occasions. And in addition to that, going into a situation, hospital or what have you, with pretty severe injuries in my mind, and not having them addressed right away. So, which that feels concerning. But yeah, the high costs, the premiums. When I was working more as a freelancer, I had top tier premium benefits, but always afraid to use them because of besides the copay, the deductible. So it always felt like I was paying out of pocket anyway if I have a $4,000 or $5,000 deductible to meet within a year. So it didn't always feel accessible, and a lot of us have we would opt out to just not use it at all.
Yeah. No, thanks for sharing that. Yeah. And the not feeling heard, I mean, especially in the out of hospital experience, like when you're in the clinic, is it related to time or style of the practitioner, or both? Like, what do you think would help that situation to be different?
I'm not sure in hindsight, like looking back, what could have been done differently, because oftentimes when you are in those environments and situations, you're under a bit of stress, right? I'm not going into the emergency room or urgent care because I don't have anything else to do. So I think that I try to be a clear communicator and ask the questions, but I feel like there's a level of, I know what's best for you coming from the practitioner, when, there's no doubt that y'all are trained and you do know a lot. But I also, as someone who's lived in this body for many years, there are things that I know about myself that I feel like when I share those things would be information in which the practitioner could use, and then we could figure out where to go together, versus it's just like, well, I'm just gonna, whether it be a prescription or, come back in a couple weeks for testing, and it's just, intuitively, that whatever it is, your issue hasn't been addressed. That can be frustrating.
Yeah.
And also, when you are paying out of pocket for your copays, $40 times 2 times a week or whatever it is can add up. So
yeah. Thank you. Thank you for sharing, that experience. So yeah, being the visit itself being just a time of stress, which makes it difficult to communicate effectively both ways. And then, yes, you spoke to the paternalism that exists in the healthcare arena, but yeah, that you are the expert in your own experience and that really needs to be honored. So thanks for sharing. And if there's other comments, feel free to put them in the chat. I'm going to keep moving through here. So as I tried to paint a picture somewhat hurriedly, but I think we all get it. We're living in these times of incredible transition, and healthcare is no different. And it can really be tempting to hold on to old assumptions and ways of thinking about how systems should operate, or like what care should look like. And I think sometimes the best way to start to uncover or explode those old assumptions is to give them the light of day. So just to call out what they are. And so some of those assumptions are that all real sources of illness have to have a physical manifestation, and that to provide effective treatment, we must find the physical source. And so let me give a couple of examples, because you might be saying, well, yeah, of course you have to have a physical manifestation. So when I was in my medical training in the late 90s, early 2000s, we were seeing more and more people with conditions like fibromyalgia and chronic fatigue syndrome. And so chronic fatigue is people experiencing disabling, often fatigue that limits their ability to work, limits their ability to do the things they need to do in their daily life. Fibromyalgia, which can be related, sometimes people will have both, can be exquisite tenderness to even light touch in the muscles. And at the time, we were seeing more and more people with these conditions, but with the limits of what was available in terms of testing, especially what people would find if they went to their primary care visit, everything seemed to be fine, right? People didn't have any abnormalities usually on their laboratory work. Sometimes even they would do a biopsy of people's muscles and they seemed to be normal. And so within the paradigm of kind of Western medicine, where, okay, we have to see something, we have to see a lab, we have to have something to cut out or address, these folks were assumed to have something that was, quote, less than a real illness, or at least something that could not be effectively treated within the limitations of that physical medicine paradigm. And there was great harm done. I think it's gotten better in terms of the, what's the word that I'm looking for? Wow, it just left my head. But this sense that, mental health care is not real health care, and that, it's separate from physical health. But many times these folks were chalked up to have, oh, well, they must just be depressed or anxious. And there is a disproportionate number of women who suffer from chronic fatigue and fibromyalgia. And also fast forward a couple of decades, and we have an understanding now that what often is happening with these folks is something that's happening actually inside of their cells in terms of how their body's able to make and create energy from the nutrition and the foods that they eat, and that process is disrupted. But that wasn't an understanding that was fully held at that time. And hence they didn't have a real condition. And we're seeing some of that now too with the phenomena of long COVID. So all of that to say that this can be, and this is a story that's repeated itself through Western medicine, that the limitations of the paradigm can often be a source of great harm to the people who are deserved by those limitations. Another assumption is that the sum of the parts equals the whole. And this, like I said, I think you see repeated in traditional practice that, oh, if we just give people the right medications and tank up all their lab values to the right level, then that must equal health. Or even on the integrative medicine side, oh, if we just give people the right mix of supplements and they eat the right foods, then that should equal health. And I think it's also helpful to remember that the root of the word health is whole. And so again, these are the assumptions within this paradigm, or this one-dimensional way of thinking about our health. And I won't even call it health. It's one-dimensional treatment that's all oriented towards the physical, and everything about our conscious intent, how we're thinking about things, all has to orient around, well, what's happening physically. But it's clear that this is not acceptable or enough for many people. And I think we've been seeing this for several decades now as more and more people are exploring and using integrative and holistic approaches, some of which fall very far outside of the paradigm of Western medicine, and having their own experiences with health transformations and with having significant abilities to support and improve their health with these strategies that often have an approach that is not just grounded in this physical dimension. And so all of this, these observations, this thinking really led me to think about, are there other ways and dimensions in which we heal besides this physical? And is that part of what we've been missing, and why we're so challenged to support people in kind of making enduring shifts? And so a lot of that's what led to this multidimensional healing paradigm that I'm going to now just briefly talk about the elements, and then we're going to talk about how it applies to fibroids. So you'll see here this picture, and I'm not a graphic artist, but we had the one-dimensional kind of physical approach to treatment, and now we're bringing in this whole other dimension, or these multiple dimensions, these non-physical dimensions, which the shorthand I give for them is the 3 Bs, the blueprint, the belief, and the belonging. And if none of that makes any sense to you, it will very shortly, because we're going to talk about each of those briefly and then talk about them specifically as it relates to fibroids. And I do want to credit that this model is really rooted in the work of Dr. Amit Goswami, who developed what he called the quantum model of health, which is really based on traditional East Indian Vedic philosophy, as well as some esoteric Jewish philosophy. This is not a religious model or even a spiritual model, but it really kind of comes out of this kind of common thread of traditional healing and spirituality practices. So you'll see that there are arrows interconnecting all of these elements because it's all related. And that's the other thing that's been an undergirding assumption in Western medicine, is that there's always these separations, right? The separations between body and mind and spirit. And integrative medicine has really tried to branch those, but I think it still has been incomplete in terms of how to really think about it. And so as we move from those old assumptions that we just talked about into this multidimensional model, it really explodes and opens up a few things. And so what are the assumptions, or kind of the working assumptions of this multidimensional model? They would be, number one, that illness can manifest on multiple levels. And so, for instance, with that example of the chronic fatigue or the fibromyalgia and things happening kind of inside of the cell, and kind of at that interface between, is this physical, or actually is this more energetic? There would be a way to conceive and to think of that, even if you don't have or know the biochemistry behind it. And that's really what some of these traditional medical systems that have been around for thousands of years, like East Asian medicine, traditional Chinese medicine, Ayurveda, have held. And we'll talk about that in a second. Another kind of new paradigm assumption is that to be effective, treatment really must start to look and address sort of health and well-being on more than one level. And then finally, that the whole is actually more than the sum of the parts. So instead of it being the jigsaw puzzle approach to health that you just have to fit all the right pieces in, it becomes more about marrying your intention, because if you remember, all of these spheres are sitting on this ground of conscious intention, but having this intention to address these multiple levels is what allows us to engage with these multiple dimensions and to really then support health in a more sustained way. So really briefly, what are these levels? And then we're going to talk about fibroids. So the first non-physical level that we talked about, or that we'll talk about, is the blueprint level, or the vital energy level. And one way to kind of think about these is to think about, well, what's the question? And the question for this level is the flow of energy aligned for healing? Sorry, I'm losing my voice. Is the flow of energy aligned for healing? And that can sound kind of woo-woo, but I like to remind people that energy is very much recognized and present in Western medicine. We use it all the time. The fact that there our energetic flows in the body. We use it every day to do EKGs on people to assess the state of their heart, and EEGs to look at their brain. But what is not present, but in modern Western medicine, but is really present in all of the other traditional medical systems, even though it may be called by different names and conceived of in somewhat different ways, is that for there to be health, there really needs to be this flow, this unobstructed flow of nourishing and vitalizing energy. Some people conceive of this energy as an intelligence, but it's an intelligence that allows the body to regenerate and heal in an organized way. And that in the absence of this organized flow, you'll start to see things that they might be pain, or they might be poor healing of wounds, or you just might see injuries that are not able to heal. So those can be some of the hallmarks, and practices that call on and engage this vital energy are things like acupuncture and acupressure and qigong and energetic practices that work with the chakra system. So the next level is the belief, or the mental level. And the key question here is, what is possible, or what do people feel is possible? And it's about really establishing a ground of possibility for our healing. And so when people have lived with chronic health conditions for a long time, when they have a strong family history and they've witnessed many people in their family have this health condition and have a very particular course, or when there's a strong cultural, societal narrative about what having this condition means, there can be a lot of limiting beliefs around what people even believe is possible for their health and well-being. And so having ways to uncover that and engage that and shift that can be a really important element and dimension of supporting people in their healing process. And then finally, and actually I'll say one thing, we're not going to go into a lot of this tonight, but the emotional freedom technique and the energy psychology that I mentioned as part of what I offer and what I do in my practice is one way to do some of this belief work. And then finally, the belonging or emotional level. Some of the key questions here are, where do I fit in? Where do I belong and feel safe? And are what I believe and kind of how I feel and act in the world aligned? And we can start to see already, that there's interconnections between this. And we can know that, for instance, our emotions are impacted by our thoughts, and our emotions impact our hormones, which can have very real physical effects. So we start to already see how all of these weave together. But the belonging level is really helping people to feel connected to themselves, to a sense of safety, to others, to a sense of purpose. And when there is dis-ease in this belonging level, it's really characterized by a sense of separation, or kind of a sense of lack of congruity or disconnection from meaning and from something larger than oneself. So that's kind of a rapid fire, but that's the model, right? The physical sphere, and then all of these other elements that are, quote, non-physical, all of them interconnected, and all of them connected by this ground of conscious intention. So how does this work? What does this look like as it relates to uterine fibroids? So I think several people here probably have some knowledge of fibroids, but just in the interest of getting us all on the same page, I'll just give a little bit of general background. So fibroids are abnormal growths. They're generally non-cancerous. Less than 1.1% of fibroids ever transition to cancer. They are present actually in a pretty high proportion of people with uteruses in women, about 70% of people, if you kind of look at them up to the time they go through menopause, will develop fibroids. That doesn't mean they'll all have symptoms or they'll all need to have some kind of treatment, but in terms of just being present, 70%. There are higher rates of fibroids in African Americans, and they often happen at younger ages. And the symptoms, which I notice I left blank there, and that's because they really vary. They vary based on location, they vary based on size, but they can include everything from abnormal and heavy bleeding with the menstrual cycle, or even between cycles, bleeding that can be so heavy that it can cause significant blood loss, leading to anemia, and in very severe cases, the need for blood transfusions. The size and mass can press on other organs, leading to urinary symptoms, feeling like you need to urinate or defecate if it's pressing on the rectum. It can cause impairments in fertility if people want to get pregnant and conceive. Could potentially contribute to early pregnancy loss or pregnancy complications. We talked about heavy periods already, cramping. Sometimes the pain can refer to the low back, and you can have low back pain. So a whole variety of symptoms that can significantly impact the quality of life. And as I said, impact fertility. Treatment has historically been kind of on two extremes, that if you weren't having many symptoms or they weren't too bothersome, we'll just watch and wait until such time that they do become more bothersome, and then you would be offered a hysterectomy or a removal of the uterus. However, there are now additional treatment options, some of which are medical. There are IUDs, which is a form of contraception. IUD stands for intrauterine device, and certain types of IUDs have been shown to decrease the amount of bleeding, so sometimes those can be used. There are a variety of medications that impact hormones, because the reason that fibroids are felt to grow, a lot of it has to do with hormone imbalance or dysregulation. There is a component of genetics that's felt to be less significant, but these medications all work on usually decreasing the signals of hormones that contribute to fibroid growth. They often have a lot of side effects, so medications are usually used short-term, either to get somebody's blood count up high enough that they can go to surgery, or to maybe get them, if they're just a year out from menopause to menopause, at which time the fibroids often will shrink. And then there are now other procedures and surgical treatments that don't require hysterectomy. So you can have a procedure called a myomectomy, where the individual fibroids themselves can be removed. Sometimes in the past, when they were first learning to do this, it would just be a few, but now I've heard of women having dozens of fibroids removed through myomectomy. And there's also a procedure called embolization, where they actually cut off the blood supply to the blood vessel that's feeding certain fibroids, so that the fibroids will shrink and regress. An important point that I want to make is that just because you have a surgical procedure done or a procedure done, it's not doing anything to change the environment in which that fibroid grew. So sometimes people with uteruses will have a surgery, they'll get the fibroids removed, and if they're close enough to menopause, maybe that's all that needs to happen, and they won't have the fibroids grow back soon enough or big enough that they'll need to have another procedure. But there is a 70% recurrence rate. And so all of that is just to say that it's helpful to, even if you've had a surgical procedure done or had your fibroids removed, to still start to think about, well, what were the things that were driving its growth, and how can I work on shifting that? And so we're going to talk about that on multiple levels. And as I said, the causes are usually related to hormonal shifts as well as genetics. So let's talk about a case. So this is Barbara, and Barbara is 42, and she was diagnosed with fibroids about 10 years ago. She's got two children, a 10-year-old and a 14-year-old, and likely those fibroids were diagnosed during that last pregnancy, perhaps on ultrasound. And she doesn't desire any more children. She has painful and heavy periods, and she has a pretty strong family history with a mother and two sisters who all have fibroids, and a mother and one of her sisters actually have had a hysterectomy. And Barbara kind of talks about this in a way where they didn't have a great experience with those surgeries, and she has a lot of thoughts about the fact that they needed to have those surgeries. She works as an administrative assistant. Her work is stressful. She also has a partner, but doesn't always feel super supported by her partner. And she also has an IUD in right now to try to manage the bleeding. And she says she's considering surgery, but like I said, she's got a lot of kind of thoughts and emotions tied up with what she's witnessed with her other family members who required surgery. So she's frustrated a lot with work, with her relationship that's not super supportive. She doesn't feel like she has a lot of time for herself and to pursue her own interests. And while I didn't give kind of a whole lifestyle assessment here, she doesn't get great sleep. She gets maybe 6 hours because she kind of tries to stay up late at night because that's her time. And she tends to eat and snack pretty late. So what might this dimensional health model look like when we're talking about Barbara? So the physical dimension, the one that most of us are pretty savvy with, because this is the one that most of our healthcare centers around, she's already doing some of this. I don't think I said it, but she does take non-steroidal anti-inflammatory medications like Aleve and naproxen to help with the bleeding and to help with her cramps, which are better now with the IUD. She's kind of thinking about surgery, but when you talk to her, she hasn't really gotten a consult to find out what her options are. And so that's kind of the traditional arena, right? That's what people often would be offered. And I will also mention she's got some digestive and gut issues, probably from all the non-steroidal she's taken through the years. On the integrative side, and so this is kind of where I come in and where for years kind of working with integrative and functional medicine, I would start to talk to people. We can start to think about that hormonal balance. And so it's felt that estrogen especially tends to drive fibroid growth. And so that can show up in a few different ways. You might see that at certain times of the cycle, the estrogen levels tend to be much higher in people who have conditions like uterine fibroids. And there are also other hormonal conditions that can be kind of estrogen dominant, like fibrocystic breast disease, polycystic ovary, although there's other things going on with polycystic ovary. And so we might think about assessing her hormone levels, which is something that you can both do in the traditional medical setting, although it's done less often, as well as some ways to look at that with functional labs. And talking to her specifically and assessing, because it's not only that people may have elevated levels of hormones, they may be less capable for a variety of reasons of transforming and, quote, detoxifying those hormones, or they may also be exposed to substances that mimic or act like hormones in their body. So doing a lot of assessment with what is she eating? How might we shift some of that to better support hormone detoxification, to make sure she's regular, because you also eliminate hormones through the stools, potentially providing some recommendations around some nutritional supplements that can help with that detoxification, and giving her the information to avoid substances that can mimic and dysregulate the hormones in the body. And that's everything like artificial fragrances and your air fresheners and phthalates and plastics, and there's a whole list. So those would be some of the things that we would do from the physical side. So now we get into some of those other dimensions. What would it look like to start to address this from the vital energy side? Well, that could look like acupuncture to support the smooth functioning of her menstrual cycle and to help moderate those heavy periods and to support her digestion, which might tends to be a little bit sluggish, I should say. In addition, as I was talking about in the intro, trying to equip her with some tools for self-management as well, which might actually look like teaching her some acupressure for self-care. And so that's actually something I wanted to share with those of you who are on the call, is just a couple of points that you can know about and use for your own self-management. And there's 2 points, and they're both listed here. The first is stomach 25. And both of these points are actually supportive for digestive health and for uterine health in terms of cycle regulation. So the first, stomach 25, you actually have 2 stomach 25 points, because we have channels that run on both sides of the body for most of the acupuncture channels. And it's described as being 2 inches to the side of the belly button or the umbilicus. And the thing to know about acupuncture is that measurements are relative. So 2 inches means 2 body inches. And that relative measurement of 2 body inches is going to be the width of your 3 fingers, kind of at this middle joint. And so that's what you see represented there in that picture, is somebody placing those 3 fingers and then the point marked. And so that's where you would find stomach 25. And when you're stimulating acupressure points, it's kind of gentle, firm pressure. You can use your middle finger and like your index finger and just gently press there, or do some slow circular movements. And this is a control point for the large intestine. So whether you're having intestinal distress and some diarrhea that needs to be moderated, or if you tend towards constipation, stimulating these points for a few minutes, a couple times a day, can support that digestive regularity. The next point is spleen 4. And again, you do have 2 of these, one on each foot, and you see it in the diagram there. And the way I would describe that is, I'm going to hold up, I'm not going to hold up my foot, but if you have your finger and you think about your thumb as almost like your big toe, then this joint here, which is called the MCP joint, is kind of like the joint of the big toe where people can get a bunion. So that's a landmark. That's not where the point is. So if you go past that joint and then you're feeling along the side of, this would be your foot, right? Because I'm using it like my foot. You're actually going to feel the bone of the, it's called, in the foot, it's called your metatarsal. You're going to feel the bone there. You may not see it. And then as you track back, you're going to feel a point where that bone kind of juts out just a little bit. And right before it juts out, that's where spleen 4 is. And so that is also a point that helps to regulate digestion in the menstrual cycle. And you can stimulate that point a couple of times a day. And you're going to do it right on the border of what we call the pigmented skin border, that where you have your pigmented skin and the skin of your palm. So those are 2 acupressure points just to know and file away. So we got 2 more levels to talk about in terms of Barbara's care, and then we'll just bring this all together. So the next dimension is the mental or the belief level. And if you recall, this is the level about what do we feel is possible for our health. And if you remember in that history, we talked about how Barbara has a really strong family history of fibroids. She kind of, when you talk to her, has this sense of just, it's a strong narrative, like it's all written, right? I have fibroids because everybody in my family has fibroids, and I'm just going to have to get a hysterectomy. And, you know, that may not go great because it didn't go great for my mom and my sister. And as a result of that, in some ways, she's kind of setting herself up for that, because she actually was fairly resistant to kind of getting the surgical consult and exploring what her options might be, and recognizing that there were some uterus sparing surgeries that she could do. And part of it is, as fibroids grow, you actually have less surgical options. So sometimes that's that way that resistance can actually contribute to making the thing that you fear being true come true. So how did we work with this? Well, and why would we work with this? Well, she had a lot of emotion tied up of being resigned and being fearful and frustrated. And so we did some energy psychology work to discharge some of that strong emotion and to really open up the sense of possibility and present time awareness, so that she could be in the present moment, not thinking about what was going to happen in the future or what the story was about her mother and her sister, and be able to fully and creatively explore what the options were that existed for her here and now in this moment. And so in doing that, she actually opted to go for the consult and to find out that she was a candidate for a myomectomy, and she ended up having one and having a good surgical outcome. And so the final, or belonging level, is that emotional level. And in her, that looked like working with some grounding and centering practices. She was often under a lot of stress, felt pulled in a lot of different directions, didn't really feel like she had a lot of time for herself. Eventually, she started to work with a somatic therapist, which helped her to, again, get more skills to cultivate a sense of safety and home in her body. When I would see her in clinic, we would do some work with craniosacral therapy together to kind of help her, again, get to a place of more regulation so that she could be better able to manage the stressors. And through this whole process, I'm not saying it's causal, but she started to widen her circle, to develop more support, to have some sister friends who would support her and actually help support her during her surgery, which that had been another big fear of hers, is how she would recover from the surgery, and just to pursue more creative outlets. So that's what the multidimensional approach kind of looks like with Barbara in the setting of the fibroids. And so, you know, it wasn't just medications and an IUD or medications in a surgery, but really starting to look at all those levels, teasing apart the physical. What can we do to actually set her up, even though she's had the fibroids removed, to be less likely to have them recur? and to also look at what might be contributing to their recurrence, both on the physical level, but also on the vital energy level and the belief level and the belonging level, for both symptom management and for just overall health and well-being generally, and specifically to the fibroids. So that's the model again, everything connected, and everything connected by being very conscious and intentional with what we were doing. So that's pretty much the end of what I have. I want to just, I'm going to come off the slides in a second. I wanted to share with you, if you're kind of intrigued or interested in learning more, there's a couple things. I am putting together, it's pretty much all written, I just got to kind of get it up on the platform, but a course on fibroids that goes into more detail about this multidimensional approach. And, you know, some of the handouts you saw, like those acupressure points, that's, you know, just one page from kind of some of these accompanying materials, but talking a lot about some of these practices, like the emotional freedom technique and how you can even kind of work with that yourself. Definitely diving into more things that you can do from a, you know, hormone regulation standpoint, et cetera, and having it be very interactive. So if you're interested in just staying in the loop and knowing about that, you can take a picture with your phone if you want of this QR code. I will also just put the link to the, it's not the course sign up, but the link to the list. If you just want to, I don't spam people, but if you just want to be on the list so that once it is available, you know about it, I've just put that in the chat. And then if you just want to stay in touch, I'm opening my practice in mid-September. I probably need to be on Instagram more, but I am on there a little bit. I'm also on LinkedIn. And I will navigate back to this page if somebody wants to take a picture of that QR code. And I am going to, yeah, if anybody has any questions or thoughts, I will stay on. If not, I appreciate you being here this evening.
I was curious about how do they even just, are there tests for for finding out like how much inflammation is in your body? Is there some testing for that, or how do you?
Yeah. I mean, so it's not an inside joke, but yeah, I think all of us in popular culture, that's kind of in the popular culture, you know, it's all inflammation, which on one level is true. And yes, there are different tests, most of them blood tests, that you can do to look at different markers for inflammation. I mean, there can be inflammation in a lot of different ways in a lot of different places. So there's some inflammatory markers you can look at that are a little bit more specific to things like cardiovascular risk in disease and you know, maybe your risk of having like a heart attack or a stroke. There are more general inflammation markers, or inflammation markers that relate more to kind of like the musculoskeletal system. So that's kind of why I said in that figure that I showed where it says chronic inflammation, like that's still not the answer. You can track it back, but to answer the question, the specific question you asked, yes, there are some tests that you can do to look at inflammation. And I think I also like to just say, you know, from the maybe camp of less is more, you know, there are choices that we can make to equip our body to be able to manage inflammation a little bit better as well, both from kind of nourishment and the foods that we're eating. Certainly things like stress contribute to inflammation, because what inflammation means is activation of the immune system. Whenever there's inflammation, it means our immune system is being activated. And so in that sense, our body is always trying to do its best to protect us, but sometimes it's an inappropriate response. And so trying to figure out what the logic is of the body and why it's mounting that inflammation. We've heard a lot about, for instance, food sensitivities. And, you know, if people are habitually eating things that they know, quote, don't agree with them, if they're sensitive to, sometimes they don't think there's a lot of harm in that. But one of the things that can be going on either silently or at a low level is that it's contributing to this constant immune system activation, which over time can lead to kind of more and more entrenched and generalized symptoms of inflammation that show up in a variety of ways.
That makes more sense. So.
Mm-hmm.
Well,
okay.
I don't know if I have any more questions. It's
You
been
don't-
very informative, so.
Yeah, you don't have to. And I understand that people may not want to come off. I totally respect the anonymity, but I see that we have two other people here, and I just wanted to thank them for being here this evening. And I'll stay on for maybe one more minute if anybody wants to put something in the chat. So I'll see it, but otherwise, thank you. Thank you so much for coming. Thanks, Kara. All right, that's a wrap. Oh, let me come off the recording. How do I stop recording?